Could your abdominal pain be or something far worse? Dr. James here from Pancreatic Cancer Warriors, and today we're uncovering the critical differences between pancreatitis and pancreatic cancer. Before it's too late. As a specialist in pancreatic health, I've seen patients confuse these conditions with deadly consequences. Let's break it down. By the end, you'll know the one red flag symptom that almost always means cancer, not just inflammation. Have you ever wondered why pancreatic issues are so tricky to diagnose? It's because the pancreas is tucked away deep in your abdomen, making it hard to spot problems early. But that's exactly why we need to be vigilant. Let's start with pain location. Pancreatitis typically causes a burning sensation in the upper abdomen. It's intense, and you'll know something's wrong. But pancreatic cancer, that pain often radiates to the back. It's a subtle difference, but it could save your life. Imagine catching pancreatic cancer early. The survival rates skyrocket. That's why knowing these differences is crucial. Now, let's talk about weight loss. Sudden, unexplained drops are more common with cancer. If you're shedding pounds without trying, it's time to pay attention. Pancreatitis can cause weight loss too, but it's usually not as dramatic or rapid. Here's a shocking fact. Pancreatic cancer is often called the silent killer because symptoms don't appear until it's advanced. But armed with the right knowledge, you can catch it earlier. Let's move on to jaundice. You know, that yellowing of the skin and eyes. It's a telltale sign. While it can happen with severe pancreatitis, it's more likely to be cancer blocking the bile duct. If you notice this, don't wait. Seek medical attention immediately. Why does cancer hide so well? The pancreas is deep in your abdomen. Tumors grow silently until they press on organs. It's like a stealth mission inside your body. But we're here to shine a light on it. Have you ever felt overwhelmed by medical jargon? Let's break it down simply. Pancreatitis is inflammation. Think of it like a temporary fire in your pancreas. It hurts, but with proper treatment, it often subsides. Pancreatic cancer, on the other hand, is like an invading army. It starts small but grows relentlessly if not caught early. Let's talk about risk factors. Both conditions share some common triggers like smoking and heavy alcohol use. But did you know that long-term, chronic pancreatitis can actually increase your risk of pancreatic cancer? It's like a domino effect in your body. Here's a crucial point: the onset of symptoms. Pancreatitis often comes on suddenly, especially acute pancreatitis. You'll likely know something's wrong right away. Pancreatic cancer, it's sneaky. Symptoms develop gradually, which is why many people dismiss them at first. Imagine if we could spot pancreatic cancer as easily as we can see a bruise on our skin. We're not there yet, but understanding these differences brings us one step closer. Let's dive deeper into digestive symptoms. Both conditions can cause nausea and vomiting. But here's the key difference. With pancreatitis, these symptoms often improve as the inflammation subsides. With pancreatic cancer, they tend to persist or worsen over time. Did you know that pancreatic cancer can affect your blood sugar levels? It's true. The pancreas plays a crucial role in regulating blood sugar. If you suddenly develop diabetes, or your existing diabetes becomes much harder to control, it could be a red flag for pancreatic cancer. Now, let's talk about stools. It's not a pleasant topic, but it's important. Both conditions can lead to changes in your bowel movements. But pancreatic cancer often causes a specific type of stool, light-colored, greasy, and floating. It's due to the lack of digestive enzymes. If you notice this consistently, it's time to see a doctor. Here's a startling statistic. Pancreatic cancer has one of the lowest survival rates of all cancers. But why? Largely because it's often diagnosed late. That's why knowing these differences can literally save lives. Let's circle back to that one red flag symptom I promised to reveal. It's the combination of unexplained weight loss, back pain, and jaundice. When these three occur together, it's almost always a sign of pancreatic cancer, not just pancreatitis. If you or someone you know experiences this trifecta of symptoms, seek medical attention immediately. Now, you might be wondering, how can I protect myself? Great question. While we can't prevent all cases, there are steps you can take. Maintain a healthy weight, don't smoke, limit alcohol consumption, and eat a diet rich in fruits, vegetables, and whole grains. These lifestyle choices can significantly reduce your risk of both pancreatitis and pancreatic cancer. Let's talk about diagnostic tools. Both conditions often require similar tests: blood work, CT scans, but here's the difference. For pancreatic cancer, Doctors might also use endoscopic ultrasound or biopsy to confirm the diagnosis. It's more invasive, but it's necessary to stage the cancer accurately. Imagine a world where we could detect pancreatic cancer as easily as breast cancer or colon cancer. We're not there yet, but research is ongoing. Your support for organizations like Pancreatic Cancer Warriors helps fund this crucial research. Now, let's address a common misconception. Some people think that if they've had pancreatitis, they're somehow immune to pancreatic cancer. This is dangerously false. In fact, chronic pancreatitis increases your risk of developing pancreatic cancer. It's like your pancreas has been weakened, making it more vulnerable. Here is something that might surprise you. The location of the cancer in the pancreas can affect symptoms. Tumors in the head of the pancreas are more likely to cause jaundice early on, because they reach closer to the bile duct. Tumors in the body or tail might not cause jaundice until later stages. Let's talk about treatment. Pancreatitis often involves supportive care pain management for fluids and dietary changes. Pancreatic cancer treatment is more aggressive, potentially involving surgery, chemotherapy, and radiation. The earlier it's caught, the more treatment options are available. Have you ever heard of There's substances in your blood that can indicate the presence of certain diseases. Research is underway to develop reliable biomarkers for pancreatic cancer. Imagine a simple blood test that could detect pancreatic cancer early. It's not science fiction, it's the future we're working towards. Now, let's address the emotional aspect. Both pancreatitis and pancreatic cancer can be scary, but remember, knowledge is power. By understanding the differences, you're better equipped to advocate for yourself or your loved ones. Here's a crucial point. Don't let fear prevent you from seeking help. Some people avoid the doctor because they're afraid of bad news. But remember, early detection is key, especially with pancreatic cancer. Don't wait until it's too late. Let's recap the key differences. Pain, location, upper abdomen for pancreatitis, often radiating to the back for cancer. Weight loss, more sudden and unexplained with cancer. Jaundice, more common and earlier in cancer. Onset, sudden for pancreatitis, gradual for cancer. Duration, pancreatitis symptoms often improve with treatment, while cancer symptoms persist or worsen. Remember, these are general guidelines. Always consult with a healthcare professional for proper diagnosis. If this video helps even one person spot the warning signs, hit subscribe. Your support saves lives. Share this information with your friends and family. Knowledge is our greatest weapon against pancreatic cancer. Don't ignore the signs. Early action is your greatest weapon. Share this to arm someone else. Together, we can make a difference in the fight against pancreatic cancer. Stay informed, stay vigilant, and stay healthy. This is Dr. James, signing off from Pancreatic Cancer Warriors. Remember, your health is in your hands.